Hi,
Hi.
my name's Christopher.
Hi, Christopher.
I was recently diagnosed with diabetes,
Uh-huh.
and I was hoping you could show me how to use my glucometer.
Absolutely, I'll be more than happy to show you how to work this glucometer. Please have a seat.
All right.
By the way, my name is Neil. I'm a pharmacist intern here at Walgreens Pharmacy. I'll be more than happy to show you how to use this glucometer. First and foremost, you said this is your first time. You've never really done it before, right?
Correct.
Okay, so here's what your glucometer looks like. It's a digital device. It's very lightweight and handheld. And these are your test strips. What's going to happen is you're going to insert one end of the test strips. I'll show you exactly which one into that meter, and this will set that up. We'll set that up before we actually draw your blood. But first and foremost, before I even draw blood to read your blood sugar levels, what I'm going to ask you to do is I'm going to ask for you to warm up your hands so you can get good circulation, and try shaking your hands below the heart level, so you could get better circulation. So before I even test you with prick you with the Lancet, which finger would you like to get tested on?
My ring finger.
Sure, I'll be more than happy to test you on the ring finger. One thing that I would highly recommend is before you even test, make sure you wash your hands so you're all cleaned up. What I'm going to do is I'm going to wipe the alcohol swab on the ring finger and put on my gloves so I'm secure. So we'll be good to go there. Another bit is make sure you have all your supplies ready so that way you're not scrambling to get everything in case you're bleeding. So what we're going to do is we're going to prepare it with having cotton swabs as well as Band-Aids and the alcohol swab, of course. So this is going to be your Lancet. It's a very lightweight handheld device. So this yellow tab is what protects the syringe from being released, and this is the actual push lever. So what we're going to do is we're going to gently pull and twist out like that so it's separated from the actual Lancet. We're going to toss that out eventually into the sharps container so that way exposed needles are not thrown right in the trash. So let me get your ring finger, please, if I may, Christopher, and we'll get this all wiped off. And while it dries, make sure your hands are warm. They're good? Okay, cool. So what we're going to do is before I even prick you with that, I'm going to put in the test strip so that way the machine is all good to go. One tip that I would recommend is make sure you have everything ready so that way you don't have to scramble again, as I mentioned. So what we're going to do is we're going to insert this chip end in that way, like so. And hang on 1 second, sorry. So that way the machine turns on. Okay, so it's going to tell you right then to apply blood onto the test strip right there. We're going to go in on an angle so that way you don't smear. And may I have your ring finger, please? Thank you. Let me get the Band-Aid ready just in case. So what you want to do is you want to make sure you go in at the side of your fingertips. So you also want to think about if blood isn't going to get drawn properly, you do have alternate sites of which you can draw blood from. So you have 3 different options besides your fingertip. You can also go in the palm, you can go in the forearm, as well as your upper arm. So in case you don't have any blood drawing options, you can definitely do the other alternate sites. So do you have any questions about that at all, Christopher?
No.
All right, let's go ahead and get this tested for you. Tip so that way you have good enough blood and it's not as painful. And what you're going to do is you're going to gently press moderately, and you're just going to go like that, and it's going to prick and squeeze so that way you get a nice firm bubble. And here, let me try milking your finger so that way you can get a good blood drop. I'm going to need a little bit more blood here. Here we go. Hopefully that's enough to kind of get the blood going. You want to go ahead and put it on an angle so that way the meter reads it properly, and like so. Alright, so as it does that, I'm going to wipe this off with cotton swab. And so Christopher, I have a question for you as I'm putting this Band-Aid on. When's the last time you had a meal?
It was probably about an hour ago.
So about an hour ago, your recommended, sorry, my gloves caught there. Your recommended glucose level according to the ADA is supposed to be between 80 and 130 if you were fasting. However, if you had food within a certain amount of hours, by the way, milligrams per deciliter, 80 to 130 milligrams per deciliter. So if you had food within that last couple of hours or so, it should be somewhere less than 180, again, according to the ADA. Yours is at 130. You're right within the range. If you were fasting, your numbers are looking good for your blood glucose. Did you have any questions for me at all?
No, I think I'm okay.
Absolutely. Well, it was a pleasure helping you out. Just make sure, again, to throw this Lancet away into the sharps container. You don't want any exposed needles. Any other supplies you would want to just discard of. And other than that, we're good to go. It was a pleasure showing you how to do that. And thanks very much for your time.
All right. Thank you very much.
You have a good one. Bye now.